Today we are breaking down what I think is a frightening TikTok trend. TikTok is good for a lot of trends, some of them good, some of them bad, but when it comes to skincare, there's always something that is the next hot item, and I'm going to caution you against this one. Today we're talking about the Hyaluron pen. The Hyaluron pen is marketed as a way to inject filler into your lips without needles, and I think there's some big drawbacks here. Let's check it out. Here we go with TikTok number 1.
I'm curious about needle-less lip fillers, hyaluronic acid.
Okay.
No pain.
All right, so we got a little bit of a demo there, but they don't show much of the process, but they do say that it's pain-free and the person's lips are definitely bigger before and after. So there's your first introduction. Let's check out the next one. Okay, so on that one, the previous video said that there was no pain, but on this one, she's pushing really hard with that thing. That in and of itself looks uncomfortable. And then you see that little gold bar that she's holding? That is a little vibratory device, so that is giving a little bit of a vibratory sensation on the lip so you don't feel pain as much. So there's definitely some discomfort involved here, especially on this procedure. Now, this device, at the end, you can see the after photo. She has a little bit of blood on her lips in the top and the bottom lip. So this is puncturing the surface by using a burst of air to propel the hyaluronic acid into the skin. And there's definitely going to be some pain with that. Your lips are going to look a little bit more full, of course, because you're injecting something underneath. But if you just took a rubber band and like flipped it on your lip, top and bottom, and you did that in several places, your lips are going to get bigger because you're going to have immediate swelling. So I'm not sure how much is due to the filler, how much is due to just the initial trauma, because what we're not seeing here is an after that's maybe 2 weeks out, and how much bigger are the person's lips 2 weeks from now versus immediately after a procedure. The real skill of an injector is what does it look like when all the swelling is gone? Because even when we inject by using needles, which is the traditional way that dermatologists will do it because it's very safe, there's going to be swelling, and we don't want to chase that swelling during a procedure. We really need the swelling to go down before we see the final result. All right, let's check out the next one. This is going to break it down a little bit.
Oh dear Jesus, it's the Hyaluron pen. And even control the depth or the amount of each injection. It uses air and just blasts the hyaluronic acid randomly into your lip. It's very traumatic. Anyone can use it. If you're lucky, you're going to have bruises. And when you're healed, if you're lucky, it's lumpy. Yay. Okay, thank God Canada did something right.
Okay, so when we look back at that, there's some significant bruising on the lips for the individual that was getting treated there. And when you saw the gel mold of the lips, so they couldn't control the depth. So the injection, one went very deep and one was pretty superficial. So that could be a concern there. So she's going to talk about what Canada is doing about this.
And banned it. Serious risks include infection, necrosis, and permanent face scarring. When a complication does happen, you're going to be on your own.
Oh.
Bargain shopping fun? Oh dear.
Okay, so at the end you saw that person had necrosis of the lip. Now, I don't know if this was due to the Hyaluron pen. It's not hard to find images like that, because one of the big concerns with any type of filler, whether it's from Hyaluron pen or from a needle, is that if the person injecting you gets the needle or the Hyaluron pen and puts product inside a blood vessel, what can happen is that the blood vessel gets occluded and then blood doesn't flow, and the area being served by that blood vessel will then die because it won't get any blood flow. We call that a vascular occlusion event, and people have had big chunks of their lip that have died. That can take plastic surgery in order to correct. I've seen people who have had their nose necrose because you hit a blood vessel that goes up to the tip of the nose, and there's multiple case reports of people going blind. One thing we don't have in our face are valves in our veins, and so if you inject product in a vein of the face, it can go backwards and then catch into the arterial system and be pushed to the eye. And if it goes to the main blood vessel going to the eye, it can cause permanent blindness. So this is a risk, and it can happen even to very skilled injectors. But here's why you want to go see a very qualified injector like a board-certified dermatologist or a plastic surgeon. And the reason is that we're trained not only in doing the procedure, because anybody can go to a weekend course and learn how to put a needle in a face and inject something, but in really managing the complications and a much better understanding of the facial anatomy structures. So there's only 4 specialties in medicine that get cosmetic training as part of their formal residency and fellowship training, and that is board-certified dermatologists, plastic surgeons, facial plastic surgeons, and oculoplastic surgeons. They're going to have the most command of the anatomy of the face. They're going to understand how to do the procedure, and they're going to understand how to manage any potential complications. Because if you do enough of any procedure, complications may eventually happen, but if you go to somebody who's trying to cut corners, they probably don't know enough about managing complications, so you really have to be careful. You don't want to group on your face. Another thing from this video about Health Canada is that nobody is talking about the risks of this procedure. Not only the vascular occlusion, but infection and bruising, and they're just making it seem like a no downtime, no risk procedure, and that's certainly not the case. Let's move on.
If you're looking for a sign to try the Hyaluron pen, this is it, girl.
So she's flinching, so you know it's painful. And that needle jumps a lot. Or the syringe jumps a lot. Okay, so we did see a before and after there, but again, this is immediately after the procedure when we also see swelling. And at each click of the button, I mean, the syringe, you could see the stopper of the syringe move like 4 to 5 ticks on that syringe. So that's quite a bit of product. When I'm doing filler with a needle, sometimes I'm placing just 1 or 2 of those little ticks and I'm putting it right where I want. I can control the depth of the needle, the angle. There's so much more control when using a needle. And so yeah, sometimes it sounds scary to be using a needle, but this procedure isn't as benign as it would seem. All right, so much more control with the needle. Yeah, please be safe. Okay, so they did the Hyaluron pen several different times there, and you could see that no 2 of the injections looked the same with the Hyaluron pen. They were deeper, they spread out more at different levels of the skin. You have very little control with the Hyaluron pen. So if you're looking for a really natural result, I don't know if you're really going to get that with the Hyaluron pen because the injections are going to go at varying depth. When I'm injecting the lips, I'm going to put more product here in the middle versus out here at the sides, and I have different depths that I want that to go to. Plus, knowing where the blood vessel is, the labial artery hiding behind the muscle there, so I know where I can go a little bit deeper and where I need to stay a little bit more superficial. And you just can't have that kind of control with the Hyaluron pen. Okay. Okay, so if you look at the lips there, they're trying to promote the Hyaluron pen with that picture of the lips. And you can see where they've injected it all the way around. No 2 of those injection points look the same. They don't have any control after they click that button. The product is just being shot in through the force of air, pushing the product out to the little hole. And I don't know how you're going to get a really good natural looking result here. They do try to compare this to the needle, and they're trying to show, if you look in the photo here, I've stopped the video, the Hyaluron pen on the left, they're trying to make it look like you've got even distribution of the product, but that's not at all what they even show on their gel model. Versus the needle, they're trying to make that look more sloppy. But we just watched back and we saw in that other video, that's just not the way it is. The Hyaluron pen is not delivering the product in that level plane across at a controlled depth. We're just not seeing that. Sausage lips. Yeah, and they're trying to say there's no risk to this procedure, and that's just not the case. So anytime you're piercing the skin, whether it's with a needle or not, there's a risk of infection, there's a risk of bleeding, and anytime we're using filler, there's a risk of vascular occlusion. The other worry that I have with Hyaluron pen is that you're already cutting a corner by trying to avoid a needle, when in my opinion the needle is generally going to give you the safest procedure, is what is being put in that syringe that's going into the Hyaluron pen. So all of the fillers that we use, whether they're from Restylane or from Allergan with the Juvederm line or with Belotero or any of the others really, they're FDA approved, they have a standardized manufacturing process, so we know that they're sterile. We can track the product, we're giving the patient a lot number and an expiration date so that if there's ever a recall, we know exactly what to do. Now, that may be the case with the Hyaluron pen, depending on where you're getting the hyaluronic acid from. We want to make sure that that product is FDA approved, that it has a lot number, that it has an expiration date, and the videos just didn't cover any of that, so I can't really comment on that. But the risk is, if you get this into your own hands and somebody's trying to cut corners, they're doing it at home, what if they're taking hyaluronic acid that's not meant for injection under the skin? There's a lot of hyaluronic acid products over the counter, and I didn't pull any of them here, but I've seen TikTok videos of people just using generic hyaluronic acid, stuff that you would get in a skincare product, putting that in the syringe and then injecting that under the skin. This is not going to be sterile. You're going to have a higher rate of granulomatous reactions, infections, and that risk for occlusion. So there's some significant drawbacks, I think, to the Hyaluron pen. I wouldn't recommend this procedure for anybody to go through. If you're interested in getting your lips plumped up or filled up, make sure you're going to a board-certified dermatologist. You want to go and have at least your procedure supervised by a board-certified dermatologist if they're using a nurse injector or a physician assistant or a nurse practitioner in the office. That's your safest way to make sure that you're getting a treatment or a procedure that is going to be safe, effective, and the chance of any complications are lower, plus any complications that do have, they can manage. So just do your research before you're going out and getting any type of procedure done, because you wouldn't want to go to have the Hyaluron pen. I just wouldn't recommend this procedure. I think there's big drawbacks. I think it's potentially dangerous, so I would avoid it. Thanks for sticking with me as we covered this dangerous TikTok trend. Again, I wouldn't recommend the Hyaluron pen, but tell me what else you want to see in the comments below. Are there other TikTok trends or social media trends regarding skincare or beauty procedures that you'd like to see me cover? Make sure you leave them in the comments below. I appreciate you following. If you're not a follower, hit that follow button, and I'll see you next time.